Hello, students. Welcome to week one of my content lecture. I like to do this pre-recorded so you have some idea of what we're covering and you can follow along with your studying. So as you know, we're going to spend all of week one, most of week one, covering the orientation PowerPoint. So I would like for you to have a short lecture prepared and sent to you to supplement your studying. So week one content, we're going to be covering several things. The topics we're going to cover are introduction to community nursing, levels of healthcare, prevention, healthy people 2030, and introduction to vulnerability. Every week I will be sending you, every week you should be looking at your syllabus to see what topics are being covered. On the left side of your syllabus for that week is the topic. In the middle section are student learning activities. This is where your readings come in, and any of your readings from any of the three books, plus any of your Canvas readings, and I'll show you what those are. And then on the right side, you have your assessments/assignments. So you have what is due. Okay, so I'm going to share my screen and show you where to find these. So I will be sending out weekly announcements. And in those weekly announcements, it will be what we're going to be covering that week. It will have your reading assignments on there, as well as assignments due. Attached will also be a summary of the weekly notes that we use every week. That's not to be used as your your study resources, because you're expected to know the readings and the PowerPoints. So in the weekly announcements, I'll be sending you PowerPoints related to that chapter. And I will also be sending you weekly notes, which are a summary. I may be sending you a pretest of the content because we're going to be using most of class time for interactive activities. We're going to be doing pre-tests, we're going to be doing post-tests, we're going to be doing case studies, we're going to be doing quizzes. You have 5 quizzes. And so you'll find each week that I'll be breaking you out into groups in the breakout rooms, and you'll have activities to do as a group. So more information to come on that, but I just want to let you know what the structure was. So let me cover week one and at least give you an introduction as to what we're covering. I'm going to share my screen. Okay, so I've pulled up the modules. So in week one, if you look at week one, you have an overview, okay? What's the reading? Okay, and this is also on your syllabus. It's taken right from your syllabus. So you are responsible for chapter 1 in the fundamentals book. Okay, you are also responsible for just page 123 in the Med-Surg nursing book, which is community care. And then you're also responsible for the Canvas readings, and they're right here in your module. Okay, so if you see these bullets, introduction to community nursing, levels of healthcare prevention, healthy people, introduction to vulnerability, those Canvas teaching sheets are found right here in the module, not in the books. So I'll show you that. Okay. Okay, so here's your first Canvas reading. It's your introduction to community nursing, and we'll come back to it. I just want to show you where to find them. Levels of healthcare prevention, that was your second bullet for Canvas reading. Healthy People 2030, your third bullet for this week's reading. And then the fourth was Introduction to Vulnerability. Okay, so your readings are split out from the book. Again, I'll show you it. Your readings are split out from the book, then 2 Canvas readings. So week one, you have two book readings, Fundamentals and Med-Surg, and then you have 4 Canvas readings. Okay, so let's go to week 2, and should be the same setup. I just want to make sure that you're understanding this. So week 2 reading, And I will be sending out a short lecture recording every week, summarizing what we're covering. So in week 2 reading, you have readings from your pediatric textbook, the Intro to Maternity and Pediatric Nursing. We have all these common childhood ailments, and you only have certain pages to read. Okay, I'll be sending out the PowerPoints that go with these as well. And then you have a little bit of reading in your fundamentals book. You have chapters 11 and 12. So you'll be getting the PowerPoints with those as well. And then you have 2 Canvas readings. Okay, write your module. Okay, so you have your school nurse and your lead exposure. And if you keep clicking through the module, here's your school nurse and here's your lead exposure. Okay, so don't forget, you're going to have a combination of readings from the book as well as Canvas readings, which are right in your module. So let's go to week 1 and let's go through what we're going to be covering. Okay, so let's go through chapter 1. Let's see. Let's go through chapter 1 in fundamentals. Okay, because you're responsible for that entire chapter. Okay, so a couple things I'm going to pull up. Chapter 1, Nursing in the Healthcare System. Okay, one of the activities that we're going to do in class, or that I'm going to have you guys do at the beginning of class, is we're going to go through the objectives. Okay, so I would say your readings are about half-half with regards to covering full chapters or partial chapters. If you're expected to know the full chapter like you are here in week 1 with chapter 1, then you are expected that you should be able to articulate the answers to these objectives. So as it says, upon completing this chapter, you should be able to do the following. So of these 12 objectives, after reviewing this chapter and reviewing the PowerPoint, you should be able to articulate these objectives. And we're going to break out in groups in class at the beginning of class and go through these objectives and have you guys answer these. Okay? So that's, and to get the answers to these objectives, it will be in your reading, it will be in your PowerPoints, or it will be in your notes, or a combination of all 3. So the goal is to have you come to class prepared, having reviewed all the readings, the PowerPoints. Okay, so for a full chapter like this, you're going to be responsible for knowing the objectives. However, in week 1 in the Med Surg book, we're only responsible for knowing one page 1023. Okay, and that's in chapter 4. Okay, so I'm not going to be expecting you to know all the objectives. Okay, because we only have partial readings. Okay, and the same is in week 2. For example, in week 2, in the introduction to maternity and peds, you have all the childhood ailments. They're all different chapters, but it only gives you a few pages to read from each chapter. So I'm not going to expect that you know all the objectives for all those chapters. However, in week 2, you're also responsible in fundamentals for the full chapters of 11 and 12. Okay, so then we would talk about objectives and answering those as well. Okay, so hope you're kind of catching on here. So let's start with going through nursing in the healthcare system. I like to go through the book and highlight areas that I think are important to know that support you being able to articulate the objectives. Okay, so for example, I know up in the objectives, it's talking about Florence Nightingale. So you need to be able, what I would do is read the objectives first and then go find that material in the chapter. Okay, so Florence Nightingale comes up on page 1A, and a lot of information about her, and that information to answer the objectives is found right here. Okay, and I would also encourage you to go to these think critically questions. Okay, and I'm going to use those as well in class as I break you out in groups and assign groups different questions from think critically chapters in the book. right? So week 2, we're going to do a review of week 1, since all of week 1 is orientation PowerPoint. So you may be in a group in which I pose the question, how is the tradition of combining religion and medical care seen today? So your group would discuss that for a few minutes in a breakout room, and then you come back and talk to the class and tell us what you came up with. Okay? Again, the whole purpose of this is having you review these lectures ahead of time, review the readings, review the PowerPoints, and you should be prepared for class. Okay? Okay. So this goes through, most of this goes, the first part goes through the historical development of nursing. Okay? I'm going to try use my mouse more effectively here. Great pictures in this chapter too. What art and science of nursing? Okay, so I want you to read through that section. Again, I also refer to this QSIN. It's quality education for nurses. These are competencies. And as I break you out in groups, I may ask you, collaborating with healthcare team is an important part of the practical nurse. Why? What does collaboration look like? How do you collaborate with team members? Okay, so if you're reading through these chapters, you'll have a good idea of how to answer that question, especially when you get into your group. Okay, so collaboration is obviously extremely important in our profession. Okay, again, between QSIN, QSIN are the competencies. Okay, the nurse's goal is to encourage growth towards wellness so that the patient can once again be independent. Okay, well, maybe the question is posed to you, how do nurses encourage growth towards wellness? Okay, or how is the care of patients planned jointly in a team by all members? So there's lots of good questions to think about in these chapters. And as you go to this section, say care planning for the patient. Okay, the explanation for caring for a patient is planned in a team. It's all right here. Okay. And then what is evidence-based practice? Okay, we need to know what evidence-based practice is. Evidence-based practice is nursing care that uses the most recent research, the most recent evidence, the best clinical expertise of the clinician. Okay, so evidence-based practice is using the best evidence we have to care for our patients. And that comes through nursing journals, research, clinical studies, clinical trials. Okay, here's another thing critically questioned. Which role of the nurse appeals to you most? Right, so what kind of nurse? What excites you about the nursing profession? Do you have any thoughts about what type of nursing appeals to you most? Okay, here's a nice visual on evidence-based practice. Best research, expertise, and taking into account the patient values. Okay. Oops. This is a good box to review as well. Box 1.1, it's a standards of practice for the licensed practical or vocational nurse. Okay, you're asked about your scope of practice on our exams, and you're also asked about this on HESI. Okay, so these are the standards of practice. You should know this. Okay, the 6 main focuses for the standards of practice of the LPN. So please review that. Okay. Then it goes through some differences of levels, the advanced practice nurse, the registered nurse, the vocational LPN, and then the CNAs. And then it gives a brief synopsis of each of those. Okay. So, this is another good section to review of different practice settings. Where do we provide care? Okay, we know that practical nurses work under the supervision of a nurse, of an RN, or advanced practice nurse, or a PA, dentist, podiatrist. Okay, but here's all the different places where an LPN may be practicing. And then I want to get towards the end of it. When you're responsible for a whole chapter, I really do like to go down to the end of the chapters. This is an excellent review after you have read through the chapter. It's the get ready for NCLEX examination key points. This is a summary of the chapter. So for week 1, you would be responsible for chapter 1. So here's a nice synopsis of that. In week 2, you are going to be responsible for chapters 11 and 12, the full chapters. They are growth and development, infancy through adolescence, and then adulthood and the family is chapter 12. But that's for week 2. But when you have a whole chapter assigned to you, please go to the end of the chapter and look at these key points. Okay. And then the other exercise that's very helpful for each chapter, if you are responsible for the whole chapter, is the review questions. Okay. And if we have time, we'll do these in class as well. So you might want to practice these. Okay. And we'll review these in class. All right. So for the next chapter of Med Surge, let me pull that up. You're only responsible for page 123. Okay, so let's go find that page because it's on your syllabus. Under Med Surge, it says community care. And that's what you are, that's the only part of this chapter you're responsible for. Hang on one sec. I just need to get it. 123. Let's see if I can. This is in chapter 6. Page 123 is in chapter 6. I haven't been able to do it from there, so let me just skip to it. And it's the community care section. Here we go. Okay, so you skip to, now, of course, I'm not going through the whole chapter here because that's not what's being asked. It's just page 123. So again, all of the objectives at the beginning of chapter 6 really don't apply. And when I send you the PowerPoint for chapter 6, and I'll show you those, you just need to go to the part of the PowerPoint that addresses this section you're asked to cover. And here it is, community care. And I've already looked ahead for you, and in your PowerPoint for chapter 6 for Med Surge, which includes this page 123, those are in the PowerPoint, there's slides 43 through 46. So they're at the end. Okay, so I want you to review community care. What does community care consist of? Home care, health promotion. Here's a whole section on what we can do to assist to prevent infections at home. Okay, it goes to different areas of the house. Okay, clean surfaces, washing your hands, handling and preparing food safely, immunizations, pets. Okay, so again, this will take you right up to the end of the chapter. Okay, so I wouldn't suggest that you go into this chapter to do all of the key points because you haven't read the whole chapter and you weren't expected to. Okay, so that is page 123. Okay, so I've covered the 2 areas in the book, and then you have 4 teaching sheets. Okay, you have 4 teaching sheets that finish up the topics that we're going to cover. Okay, the other thing you have that I want to remind you of is levels of healthcare prevention. Or we'll get to, I'm sorry, we'll get to it when we get into the Canvas reading. So let's start with the first Canvas reading. All right, Introduction to Community Nursing. All right, Introduction, Community Health Nursing, what is it? What are the roles and responsibilities? Okay, so community public health nursing is not entirely different in nursing practice with that of the clinical nursing in the 4 corners of the hospital. Okay, so what this class is doing, um, this class, the reason why this class is at the end of your program is you're being asked to bring all of your knowledge forward from peds, maternity, geriatrics, fundamentals. You're asked to bring all the concepts that have been covered. In fact, all the concepts, most of the concepts should be covered as you come into this class. We're trying to pull everything together. Okay, so we are now taking the patient out of the hospital setting, moving them into the community setting, which could be a home, assisted living, long-term care, could be hospice. Okay, so we are now moving that patient care into the community, and that's how I want you to think of this class. We're now in the community taking care of patients. Okay, so what are the duties of a community health nurse? Okay, they're right here in these bullets. Okay, so community nurses, we do a lot of education. I know we do a lot of education in the hospital, but we do a lot of education in the community. Okay, we're trying to encourage and promote healthy behaviors, healthy lifestyles. Okay, we're constantly, since we're community nurses slash public health nurses, we're constantly evaluating the health of our communities. Okay, we're assisting with whatever the needs are. Is there a high prevalence of teen pregnancy? Is there a high prevalence of drug abuse? High prevalence of homelessness? High prevalence of elderly? Okay, we as the community nurse do those assessments. What does the community need to try and be as healthy as they can? Okay, so screening tests, education, outreach programs, right? Collecting data, doing research. If you're a public health nurse, you are collecting data, you are doing research. Maybe you're working with a school that might have an outbreak of pertussis. Okay, remember, there's all different kinds of community nurses, and we'll talk about this through the term. There's a school nurse, there's a faith community nurse, there's an occupational nurse, there's a home health nurse, hospice nurse, all kinds of community nurses, and we'll talk about all of that as we go through the term. Okay, immunization. If we're working as a community nurse, we're part of immunizations. Okay, we are part of a coordinated team that is providing community health resources. We are involved in emergencies or disasters. Okay, here's some roles we might be able to play. I'm not going to go through these line by line because I want you to prepare yourself and read this. Here's some roles we may play. Program planner, right? We identify the needs and concerns of the community, and we may, and remember, the other thing about community is community can be characterized as you're working with an individual, you might be working with a group, you might be working with a whole family, or you might be working with the whole community. So community, your clientele can be identified as any of these 4: individuals, groups, families, and community. We are still formulating health plans. Could we do the same thing we do in the hospital? Just because they're in the community doesn't mean we don't have to still do a plan of care. Okay, we work as a team in community health. We're assisting other team members with whatever programs need to be implemented. We're also a health educator, trainer slash counselor. Okay, we also may be a community organizer where we're setting up health fairs or educational programs. Okay. So have a look at this, and these are all of our different roles that we can play. There's a lot. Community nursing is big. We are taking all of our tools in our toolbox that we've learned from clinicals and nursing school, and we're now applying all those into the community. And there's a section on how we responded to the COVID pandemic, how we think it might change post-pandemic. Okay, so for decades, nurses have dedicated their careers to public health initiatives that promote and enhance safety and well-being of community. That's our goal. That's what we've been doing, right? However, with this pandemic, it's highlighted some really important roles that have brought renewed attention to the role of the community nurse. Okay. So there's some great articles here to link to. Okay. The next Canvas reading we had was the levels of healthcare prevention. Okay, that's the second bullet point. Okay, so what we need to understand here, and you're going to hear it brought out through the entire class, is levels of prevention. We have primary, we have secondary, and we have tertiary. Okay, primary, P for primary means preventative. So primary care is preventative care. Okay, secondary, the S goes with the S for screening. Okay, so early identification, early screening to try and prevent something from becoming a disease or a chronic illness. So P is for prevention, secondary, S is for screening, and then tertiary, I use testing. Okay, so they already have, in tertiary, they already have a disease. They already have a condition. So we are trying to help them manage it. We are testing. We are trying to help them rehabilitate. Okay, so here's a little bit more information about primary, secondary, and tertiary. So have a look at that. That's going to come up every week in every chapter. All right. So have a look at this sheet because we do need to understand primary, secondary, and tertiary. We'll talk about that in class as well. And then we're going to refer to Healthy People 2030 the whole term. Okay. We have just transitioned in the last couple of years from 2020 to 2030. Okay. So you will get asked about this in exams. Okay. What are the goals of Healthy People 2030? Okay. I don't know if you've heard of Healthy People 2030, but historically, this Healthy People initiative began in 1979. Okay. And so we went from Healthy People 2000, we've gone to Healthy People 210, we've gone to 20, and now we're at 230. Okay. Okay. And have a look at these goals. Okay. It's a national initiative. Attain healthy, thriving lives. Thriving lives and well-being free of preventable diseases, disability or injury or premature death. Eliminate disparities. Okay, so these are their overarching goals. So please have a look at that and open this website. Okay, take a look at that. The other area I'd like you to explore is what are social determinants of health? What's a social determinant? We're going to talk about that in week 2. But I'd like for you to open this link and take a look at basically determinants is a fancy word for determines. What are the social determinants of health? So what are the social issues that affect how people are affected by health? Maybe education, poverty, vulnerability. And then in this week 1, we have an introduction to vulnerability. So this whole class is based on vulnerable populations. Most of our community work is with vulnerable populations in the community. Okay. So what do we consider vulnerable populations? Okay. So we have vulnerable groups based on location. We have a section on why are children so vulnerable? Why are the elderly considered vulnerable? So we have three sections here: location, children, and the elderly. Some other vulnerable groups are the chronically ill, American non-English speakers. How do we tell the difference between an at-risk client versus a vulnerable client? Okay, so the definition of risk depends on exposure, right? So for example, everybody, all of us are at risk of dying. Okay, but only legally married people are at risk of divorce. Okay, it's a fine line between at risk and vulnerability. Okay, so the difference between vulnerable and at risk populations comes down to the difference between condition versus status. Right, so vulnerability, I'm reading right here. Vulnerability refers to one's general condition or state, age, gender, right? So for example, seniors are vulnerable by virtue of their relatively decreased activity or their age, right? Risk factors to these specific causes are to what they're exposed to. For example, people who live in glass houses are exposed to the risk of stone throwers. Okay, so we need to understand the difference between vulnerability and at risk. Okay. So again, I'm just trying to give you a summary of what your reading is this week. Okay. And then here's your discussion for this week. Okay, we're talking about vulnerable populations. So your assignment for this week, choose a vulnerable group from this week's readings. Describe the resources and programs that are available in your community to them. Are there any gaps in service? Meaning, are there services that don't exist that should? Okay, so that's your assignment for this week. The other thing I want to show you is I'm going to be sending you the PowerPoints. Okay, so for example, this is where I found in the Med-Surg book, you only had one page. It was page 123, community care. So I went all the way down here to find community care, and I found it on slide 43. Okay, so you don't need to review the other 42 slides in this PowerPoint. You need to go find the section that you're asked to cover. Okay, so community care. So these 4 slides are a summary of what's in the book. Okay, but if you go to section or chapter 1, let me show you here. And you're going to get these attached to your announcement. I just want to show you. Okay, so week 1, PowerPoints. So I'm going to be sending you Med-Surg, week 6, which I just showed you. You're responsible for the last 4 slides. However, in the fundamentals, and remember the PowerPoints are really a summary of each chapter. So since you're responsible for all of chapter 1, I would highly suggest that you review this PowerPoint. Okay, PowerPoints are a summary of the chapter, so don't just go through the PowerPoints and say, okay, I'm done. I would go through the PowerPoints as I'm reading through the chapters. Okay, just because they're a summary, there's still more information to gather from the book. Okay, and then the other thing that I'll be sending you in each announcement is notes. We have weekly notes for everybody, or for every week, I'm sorry. So I'll be sending you these week 1 notes. Okay, and this is also a nice summary of what we covered. Okay, so week 1 notes, we're talking about what is community nursing? What's the difference between community-oriented nursing and community-based nursing? I didn't cover that in my lecture, but The simple difference between community-oriented nursing and community-based nursing, if you're community-oriented, you're focused on the healthiness of the whole community. Okay, health promotion, health teaching. Okay, you're focused on the community rather than the individual. If you're community-based nursing, I remember it by you're essentially based in the community. You're taking care of ill individuals in the community. Okay, so you may be working in home health care, schools, hospice, occupational health. We're focused on individuals and illness care versus population. And then we talked about primary, secondary, tertiary. We talked about Healthy People 2030. So again, another summary of what was covered. Okay, I asked you to review social determinants of health on the Healthy People 2030 page. There's a nice summary of it. And then vulnerable populations. So again, it's a supplement to your reading. So what I would be doing, the rest of this is all vulnerable populations. So what I would be doing, stop sharing, is I'll be sending out my week 1 announcement later on. Okay, it's going to include, I already sent you the orientation PowerPoint. It's going to include the PowerPoints from the readings. Okay, there are no PowerPoints for the Canvas readings. So you had 4 Canvas readings. Remember those? They weren't in the book. They're in your module. There are no PowerPoints for them. There are PowerPoints for what's in the book. So I'll be sending you the PowerPoints from the book. I'll be sending you the week 1 notes. You already know what the readings are. And what else? I may send you a pre-test. I'm not sure yet. Because I would like to see how well you prepared for class by doing a pre-test at the beginning of class. Maybe break you guys out in groups and you guys can go through and answer the pre-test questions. And I think that's it. That's my coverage for week 1. I hope that gives you a good start. Since we're not going to have any time for content in week 1, because we're doing the orientation PowerPoint. And actually, I'd like to do this kind of recording each week before class so that you can take this recording, review it with your readings, review it with your PowerPoints, review it with your weekly notes. If you do that, you should come to class well prepared and be able to participate fully in the group activities that we're going to be doing every week. Okay? All right. Well, I look forward to seeing you guys in class this week at orientation, and we'll talk to you later. Okay. Bye.